Good evening, everyone. My name is Mike Lynch, and I'm with the Enrollment Management Division at Emerson College. Uh, Thanks for taking the time to join us this evening. We are very excited about our still relatively new Health and Social Change program, and we're certainly excited for you all to learn more about the program as well. We're actually welcoming our first incoming class this fall. They just got to campus, so we're super excited. The major is now officially underway. This is a really exciting major, we feel, that explores and really looks at the impact of the critical aspects of healthcare in the US and around the globe. And I think it's an exciting program that really is going to give students an opportunity to really explore the opportunities within the healthcare system. With that said, let's go ahead and get things started. I'm going to go ahead and turn things over to our faculty from the program who are here with us this evening. They'll introduce themselves and then we'll get the presentation started. Go ahead and turn things over to Jessie.
Good evening, everyone. Thanks for joining us to learn more about the Health and Social Change major. So we're going to start with just some introductions. I'd like to tell you a little bit about me, and then we're going to hear from Professor Allen about her work here at Emerson. So like Mike said, this is a brand new, really exciting major. We'll have our first class this fall, and I was hired in part to help direct the new program. So my role here is the Health and Social Change Program Director. And my background, I studied health communication. That's what my PhD is in. And I've worked for the past few years also as a mental health therapist. So I kind of have a foot in the academic world and also a foot in the mental health profession. As the program director and faculty here, I'll be teaching some of the core classes, which we'll talk to you about, classes like the Health and Social Change Introductory course, which is called HE 200. I'll also teach classes related to my own areas of research interest, related to the impact of media portrayals of mental health, and sort of thinking about how do we eradicate the stigma kind of associated with those representations. So I'm really excited to be here and to talk with you all this evening about this major. And now I'll have Nancy go ahead and introduce herself. Thanks, Nancy.
Hi, I am Nancy Allen, and I'm thrilled to welcome Jessie, who's brand new to Emerson for this major. I have a background in public health, and a lot of my background was related to HIV/AIDS work. So I have classes on the war on drugs. I have classes on sex, society, and health, disability in the media. I've taught classes on plagues and pandemics, on health communication campaigns, and there's probably a very good chance that I will be teaching some of the required courses in the major in the future. So a lot of my background is related to a variety of public health topics, and I'm really looking forward to finding out what areas of interest prospective students have. I'll turn it over back to Jessie.
Thanks, Nancy. And so I'm the program director, and it's important for you all to know Nancy has been integral to this whole development of this program. She's been working on this for years to make it something that we think is going to be really exciting and also really meaningful and impactful for students here. So I think it makes sense to start, talk about for whom is this major. I think when we in higher ed, in universities and colleges, we think about what attracts people to a major. And often students end up finding themselves, they find that they're gravitating toward or gravitating to, causes, interests, people who reflect their own interests and passions and inspirations. And so I thought I'd take a few minutes just to sort of talk about who might find that the Health and Social Change major is a good fit because of their interests, their passions, what they want to learn about, what kind of knowledge they're looking to gain here at Emerson, and also what they're hoping to do after they're done here at Emerson. So I think, the health and social change major is a big tent. There's lots of different ways that I think that we can speak to people's interest in health broadly. So here's a sampling. If you're someone who hopes to learn how to make the world healthier and a more socially just place, if you're someone who's really interested in championing social policies that are aimed to make communities and neighborhoods healthier, if you hope to work to reduce health disparities and inequities in healthcare, maybe you're someone who believes and feels like your calling is to fight for the right to reproductive health and justice. Maybe you're someone who cares, like I do very much, about fighting mental health stigma. Perhaps you're a person who desires to better understand how to improve access to healthcare. We know that there's a lot of concern about healthcare and access, especially for vulnerable communities. Maybe you're interested in promoting public health education programs. You see yourself somebody who's leading public health strategy education to help people and communities become healthier. It's possible that you might be somebody who's really interested in or already plans on going into a health career, a medical or health career. And maybe as a health professional, you are really committed and plan to integrate health equity and social justice into the work that you'll be doing with individuals and communities. Maybe you are really wanting to focus your career and you're learning on how to fight the impact of climate change. Maybe you're somebody who just identifies yourself as a change maker in your community, whether that's here at Emerson, in your neighborhood, or more broadly in the nation and in the world. You're somebody who's interested in making social changes and having real world impacts and addressing real world problems. Maybe you're somebody who, like Nancy, actually, who does a lot of work with our union here. Maybe you're somebody who's really interested in working to advocate for fair and just labor conditions. And maybe you're somebody who wants to find ways to fight and prevent systemic racism from hurting people and communities. If you see yourself in any of these kinds of areas, callings, I think the health and social change major is a really good option for you to consider. So and again, sort of thinking about where do you feel like you see yourself reflected? What kind of community are you drawn to? What kind of communities are you drawn to? What kind of students do you want to spend your time with, and teachers and mentors? So I want to talk a little bit about some of the sort of structure of what the health and social change major will be like for you as a student here at Emerson. So I'm just going to talk for a few minutes about some of the kind of key topics, theories that you can learn as a health and social change major. This is just an academic overview that kind of gives you a sense of the core topics. So I think it's important for you to understand that health and social change is an interdisciplinary major. That means that we are drawing from experts, from classes, from mentors, from teachers, other students across Emerson College. And so I think one of the common threads at Emerson is it's, folks who are interested and wanting to sort of develop their communication skills and sort of go into various communication related fields, and many folks who feel like they are storytellers. And so if we think about what is necessary to really focus on and do the work of health and social change, we need people from the sciences, we need people from the arts, we need people from various sort of communication study disciplines. We need folks from across the college, from all different disciplines, to really do the work of health and social change. And we try to reflect that in our development of the major and in thinking about the very things that you will study in your class, the kinds of readings, and also the applied learning opportunities that you'll do. So some of the core foundational elements include studying the culture of health. What do we mean by health? How do we define that? Who gets to define that? Learning more about medical and public health systems. We're also going to talk a lot in the major about environmental health, and we'll do that kind of from a global lens, a global perspective, because we understand that environment here is connected to environment all around the world. We're going to spend time in the major making sure that you develop skills to understand, to interpret, and perhaps even to contribute to various kinds of health and social change research. So you'll be able to look at both quantitative data and qualitative data. You'll learn sort of the ins and outs of how to engage with all of the sort of information that exists in our information environment about health and how to translate that. Like I said, because it's an interdisciplinary major, you're going to, spend time as a student taking classes in the sciences. So you'll learn about biological, physical, and health sciences. There's a number of electives that Nancy's going to talk with you about that are related to sort of learning more about the philosophy and the approach of the scientific method. And lastly, but not least, probably most importantly, I think, is that a core element in this major is really going to be focused on learning. You're going to learn about health disparities. Who gets more access to health? Who gets, who doesn't have easy access to healthcare, well-being? Why is that so? So we're going to talk about health disparities, who's impacted, how the experiences of racism and oppression and marginalization make some people and communities more vulnerable for illness and for a lack of access. And that will include a lot of conversation about the social determinants of health, like what are the key sort of foundational things that people and communities need to be healthy, to have good access to healthcare. And lastly, we're going to spend a lot of time in the major, in the classes, and again, in the projects that you'll do, teaching you about advocacy. What does it mean to be an advocate? How can you understand and engage with health policy makers? And what ultimately does it mean to enact social change, whether that's sort of at the individual level or sort of more, at the macro level in neighborhoods, communities, and in the whole world. So those are the core kind of foundational elements. And, I think one of the things that's important as you're thinking about this, the possibility of being a part of this major, is to understand this major is about applied learning experiences. We can't just sit, read books, and talk about theory. We have to be going out into the world, into the very neighborhoods and communities that we're connected to, that Emerson is connected to. And that's where we're going to learn about how to engage with diverse audiences and how to really make impactful changes that are going to address health inequities from the sort of social justice framework. So that's a little bit about kind of the key elements. And now I'm going to turn it over to Nancy, who's going to talk more specifically about the kinds of curriculum, the classes, what the class structure, what you can expect to do as you're learning for the next few years in the major.
So this is an example of what the curriculum would look like for the required courses for somebody coming in as a first-year student in terms of year 1, 2, 3, and 4. We can work with folks who are transferring in as juniors or sophomores, so that is also an option. So assuming someone comes in as a first year, their first year they would be taking health, equity, and social change. Jesse's going to be teaching that this fall. Really looking at those questions that Jesse asked at the beginning. What do we mean by health? Who's most impacted by health disparities? How can we begin to think about affecting change in neighborhoods to engage so the neighborhoods are more healthy? Then students will move on to health and advocacy, HE201, and that is really going to be looking at both how we want to frame messages for various audiences in media. So maybe it's through entertainment, maybe it's through journalism, maybe it's through communication campaigns, and then particularly how advocacy might play a role when it comes to changing the rules, the laws, the regulations that affect all of us. So this might be thinking of strategies for how do we engage policymakers on Capitol Hill. Year 2, students will take a class on culture and global health. We're going to be also offering that this fall. It's super popular already. And that's really taking many of those same concepts that you'd be learning in year 1, but looking at them at a global level. So we will be looking at a wide variety of health issues that are particularly pertinent around the globe, whether it's climate change, but it could also be things like access to clean water and sanitation. Maybe it's around vaccines, which countries should have access to vaccines first in the middle of a pandemic. These are very pertinent questions that public health has been asking. We have a fabulous person in the science realm who's going to be teaching the environmental change and human health course. And so that's really looking at the intersectionality of humans, animals, and the environment, right? So we are all connected to one another. And so changes that humans make can have impact to the animal world, which can have impact to the environmental world. So looking at some of those issues. Then as we're getting into upper level classes, students will be spending a lot more time with health data and research, as Jesse was saying, and really understanding how to interpret basic epidemiology, so getting a grounding in that, how to interpret basic scientific research that you might be reading in professional journals, but then how to translate that data and research for a lay audience. What we want to do is make sure that our graduates are able to speak many different languages. And I don't mean, English, Spanish, Portuguese, though yes, that's all wonderful. I mean, you can talk to a doctor and understand clinical speak. You can talk to a scientist and understand scientific research, but you can also make that same information palatable and understandable to your next door neighbor or to your cousin, right? To an everyday person. And that's one of the goals with this major. We'll also spend some time looking at ethics and looking at some of the missteps in the past that we have seen around medical research, public health, ethics, things like that. We want students to really have that basis in what does the healthcare system look like? Who does it work for? Who does it not work for? What's the role of insurance companies? I'm still trying to figure out co-pays. That's not my area of expertise. What I know is the public health system. So really looking at, that's the other piece of that class, having students understand how the world of public health is structured and set up at the local, state, national, and international levels. So going all the way up to the United Nations and the World Health Organization. And then in year 4 is really, we anticipate that students will have been doing a lot of on the ground work through their classes and through student organizations and internships throughout the 4 years, but definitely in year 4, we're going to be putting the theory and skills that students have been learning into action. And so we have students will be engaged in a project management, so that they'll have group projects where folks are working on implementing some of those skills, solving problems, putting forward solutions, and then in the capstone, really working to implement that. So it could be a health communication campaign, it could be writing material and content, it could be developing a script for a video, it could be a wide range of things. Those are the 8 core curriculum that students must take to fulfill the major. In addition, we're requiring students to take 2 extra science classes besides the usual one that they're required to take for the liberal arts. We have lots of different science classes for students to choose from. We'll look at those in a moment. And we've got a bunch of other electives that students can choose from. So for science, we've got classes that are sort of on the human health side of things, really looking at human health and disease, or things like nutrition. We also have classes that are much more focused on the environment. So it might be around climate change or energy and sustainability. And what we anticipate is that students will work with their mentor, their advisor in the major, to come up with a unique plan per student about which one of these classes might be most appropriate and most of interest to students, depending on what they think they want to do in the future. So if I know a student really wants to go and get a master's in public health in the future, I might suggest a class like plagues and pandemics, because I know it talks more about infectious diseases and epidemiology. But for another student, I might recommend some of the environmental classes. So we'll work with students one-on-one around recommendations. Our list of electives within health and social change this is our current list. It's going to continue to grow, and we're going to begin to start grouping it by topic areas. Right now, this is sort of a whole lot of classes across the college that we've put together, but we anticipate more and more and more in the future. So we anticipate that there will be classes that are really specific to certain areas. So classes around mental health for students who are interested in that topic. We've got classes around food and nutrition. I teach a class on the war on drugs, and I teach a class on sexual health. We're anticipating more classes on disability. We have a bunch of environmental classes, not just environmental science, but these might be things like environmental ethics, you know, some other ethics ones, the ecology and economics of rivers. There we go. We also want to encourage students to take skills-based classes, particularly if they're related to health. So digital storytelling, nonprofit fundraising campaigns, health communication campaigns. We want to encourage students to explore other majors and other minors in terms of developing skills. You know, if someone wants to go to do journalism, you know, maybe taking a storytelling class through journalism, or a video class, and learning to take some of that content and bring it into the major, because we know that affecting social change can happen in a lot of different ways. There's not one single path. So this list will just keep growing. The learning outcomes are going to feel kind of repetitive because a lot of what we just already talked about there, it's all in here. Really about identifying and applying principles of diversity, equity, inclusion. That's number one for a reason. We have really centered social justice at the beginning of this major. That's why we talk about social change. We're looking at all of these things in an individual, cultural, social, and environmental construct so that folks can work at any level within the public health realms. We did mention earlier, we want students to be grounded in science and evidence. So that's why we have those extra science requirements. But we are also unique compared to other programs and other colleges because we are a school that also have School of Communication, School of Arts, and we want to leverage that. So we're really invested in having students critique how the arts and media influence and impact health and social issues. So we learn just as much from the news and from classes as we do from our favorite television episodes. A lot of times that's where we're getting our health information. It's from that. It's from what somebody in our family member, you know, posted on Instagram. So we want to really make sure that we're looking at how people are getting their information and how we can put information out there that's accurate, that grabs people. We mentioned earlier, we're going to be looking at the US healthcare and public health systems, really looking at health data and research. And we want folks to be able to not only describe and analyze the health problems, but also develop proposed solutions. So 7 and 8 really go hand in hand. Those solutions could be policy, it could be practice, it could be interventions, it could be communication campaigns, all sorts of things. And then we kind of bookend social justice. It really matters to us. So we really want to end on promoting social justice, health-related outcomes. And of course, as a school of communication, we want to make sure that our students leave with the ability to effectively speak and write for a wide variety of audiences. So sort of being a translator, if you will. The thing that I also want folks to realize is that if you are trying to decide between health and social change and another discipline, you can find ways to work and combine these things. So we think that this major pairs very well with majors, like if you folks want to double major or get a minor in, say, journalism or marketing communication, polycom, because the skills that someone has in journalism to become a reporter is important to understand, but so too is understanding the content related to health if you want to be a health and wellness reporter. My area is behavior change. I love talking about behavior change, and I really lean on a lot of marketing skills and taking a lot of what I know and learn from marketers. Somebody who wants to affect change through policy, they really should know how the political system works, right? And so taking classes in political communication. The major is housed in the Communication Sciences and Disorders department, and their focus is really around accessibility and inclusion as it relates to disability. So that might be an area someone wants to focus in, take classes in CSD. And then we have a brand new major in media psychology. So this one's really focused more on media and how people are engaging with media messaging. So, of course, you're probably wondering, what could I do with a major such as this? So, we anticipate that some of our students might go on to graduate school, and we'll talk about those options in a minute. Most will probably go into employment options early on, and we anticipate students can work specifically within the public health realm if they really want to go work for a public or community health agency, or a lot of public health work is done through government. So I worked for the state Massachusetts Department of Public Health. That's where I got my start in public health. But so much of this work is done in the nonprofit realm, whether it's health specific topic areas. So we've got, health, there's nonprofits related to breast cancer, to environmental justice, to reproductive rights, you name it, whatever health topic there is, there's definitely nonprofits that work in that realm. We have partnerships with some of those nonprofits, like Boston Healthcare for the Homeless, things like that. That work can also be done at an international level. We anticipate that we're going to have some students who might really focus within healthcare settings. So maybe they might go work for hospitals, insurance companies. They might look at how to advocate for folks within those systems, particularly around disabilities. We want to make sure that our students can also go into other arenas, such as journalism, public relations, advertising, so that they're getting those skills, but they can do so for health and social change. We've got folks in hospitals doing health insurance work. Health insurance companies are actually some of the folks that are doing the most prevention messaging because they have a financial incentive to do so. Not to mention, almost every single company or corporation has a wellness initiative through their human resources that they want to engage their employees in health and wellness activities. So we anticipate that. And we have a definite focus on the arts. So whether that is combining health with theater or through narrative writing, lots of different ways through video. We have students who, I've already had students go into graduate school in public health before we even had the major, and that's been really exciting to write those letters of recommendation for my students, and they're graduating with their MPHs. But we also know that we have got students that are going to go into other arenas of allied health, maybe occupational therapy or physical therapy, speech language pathology, folks that might go into health science or health education, medical anthropology, or folks that might want to go on the more creative side, creative expressive arts therapies, or social work like Jessie. So when Jessie talked about us being an interdisciplinary major, you can kind of see that with the graduate school options, and you can also see that from the background of the faculty who teach. We all come from very different disciplines, and we want to make sure that our students get a taste of those and can decide where they want to go next.
Thanks, Nancy. So, I want to just sort of close with a couple of remarks, and that's really about I think what you can and should expect about what it's going to be like to learn here, to be a part of the Health and Social Change program. I think one thing that feels really important to know is that we welcome, we invite, and we think it's like an integral part of what it means to be a health and social change major, to work with, to be mentored by faculty and community members who are committed to being social change makers, who have a broad array of experiences. So this is going to be, this program is going to give you connections and hopefully relationships, meaningful relationships that you can use for your whole professional career, whatever that might look like. We also, I said this earlier, but I think it's important to know that the health and social change major is going to be in part defined by the engaged learning experiences that students will have, working with local communities, doing hands-on skills building, and really working to do health change, to affect social change, address health inequities right here as they are attending Emerson College. This is not a major that expects you to wait until you're done with graduation then to go off and to do the work. We're going to be doing the work all along the way as you're taking classes during your time here at Emerson College. Lastly, I think it's important for folks to know this is a new major. We're excited. There's a lot of energy and enthusiasm. And what that means to be a part of a new program, a new academic program, is that we are inviting students. We hope that students will work in collaboration with all of our, sort of all of our community members to help build and contribute to this new major. We want to reflect the most current pressing issues in various health contexts. We want to be able to address those and to make sure that what we're doing reflects not only students' interests, but sort of what is happening in the world and kind of the needs that need to be addressed with respect to health equity. So we're really excited. This is just the overview. And I think, the last part, which I started with at the beginning of this webinar, is, to really think about your major. We hope that it's health and social change, but to think about your major as a place where you develop community, and hopefully a community of people who are inspired and passionate the way that you are. In the health and social change major, we expect that we will be a community of people who are committed to social justice and equity. So we're going to stop chatting there, but just with sort of an end note that you are welcome, invited. Please feel free to be in touch with us. You can contact us at any time. Our information is here on this slide. We are here to answer your questions and to help you think about sort of not just Emerson and the way that Emerson will fit with you, but also how health and social change can be a part of your academic career here at Emerson. So we're ending here, but we want to invite any questions that you all might have. Thank you.
Yes, thank you, Jesse and Nancy. That was excellent information. And if I could do it over again, I think I might be jumping in on this major. It's great. A lot of important things that we're examining in this program. So with questions, we did have a couple that were submitted. So certainly maybe we can ask a couple of those before we wrap things up. So one, I know we talked about sort of potential outcomes, things of that nature, and certainly the hands-on aspects of the program, but student was wondering a bit more about maybe specifically internship opportunities or co-op, if you will, but really more, I guess, focus on internship opportunities, what types of things we might see being affiliated with the health and social change program.
Sure. So we've been spending a lot of time as faculty talking about our pre-existing networks and who we are already working with, as many of us are practitioners. So we are anticipating really pulling together a list of organizations that we have experience with, that we know, and can help guide students to internship opportunities. Whether that's for credit or just to do on their own. I see even just positions, jobs that students could be doing part-time to get to know and understand a wide variety of public health areas. We also have the Social Justice Center here at Emerson College, and we've been partnering very closely with the Social Justice Center as we've been developing this, and they have their own relationships with a whole bunch of community organizations. So we're anticipating, leaning on our various relationships across the college. There are also things that students can do, like the engagement lab, where they can take classes that the entire class together has a client. And we have 3 initiatives. The first one has been around gun violence. The one that's launching right now this year is related to climate change. And I believe they're planning for a future one related to mental health. And the whole class works multiple semesters in a row with one client to develop, maybe it's videos, whatever it might be that the client needs and wants. We're going to be doing a lot of that hands-on work in the core curriculum as well. So our anticipation is that students will have opportunities to work with real live organizations in classes, as well as outside of class on their own with internships. I know I keep getting a list from the Department of Public Health of all of these local health departments that are looking for students, and so there's opportunities to apply to be part of those public health core programs. Jesse, did you have anything you wanted to add to that?
No, I think that sounds good. I think just it feels important to know that like when we think of what it means to be engaged in the community as an intern, that doesn't look like just one thing. We can imagine that people might be drawn to working, at the State House right here in Boston, across the street, like with policymakers, or with any of the very, kind of, I guess, like esteemed healthcare organizations, the hospital systems here in Boston. So I think, we're so well positioned at Emerson College to really facilitate all kinds of internship and learning experiences. And that's exactly what we hope to do with this major.
Yeah, excellent. Thank you. Yeah, I was thinking the same thing, that although not exclusive to only Boston, being right in the heart of Boston certainly doesn't hurt in terms of healthcare industry, nonprofit leadership, all those wonderful things, the State House, like you said. So definitely our location doesn't hurt. That's for sure. So I know we talked a little about and went through sort of the various classes that make up the major, including electives and things of that nature. But so I think we have a sense of that, but maybe if you all could give some perspective on maybe how you set up the environment, the learning environment in your classrooms themselves, and sort of like, I know it might vary depending on the type of course you're teaching, but from your perspective as a faculty member, how do you like to arrange your classroom settings to really maximize that learning experience?
Yeah, I mean, I think as I intend to start teaching the health and social change class tomorrow morning for the first time, I'm thinking a lot about this idea of community and finding, creating meaningful relationships and connections with people who have the shared sort of passion, vision, interest in health equity and social justice. So I think that the classrooms in the sort of like teaching focus in the major necessarily requires that we spend time getting to know each other, building community with each other, understanding like how we all conceive of and what draws us to the area of health, what health, which health contexts. So, a thread I think through my teaching in the major certainly will be focused on facilitating building community with each other here at Emerson, with the broader Emerson community, and then sort of with all of our, neighbors here in Boston. And I think, I think that feels really important to me. I don't know, Nancy, if there are particular things that you have, envisioned for, sort of what the classes in the major feel like for our students.
I feel like conversations that you and I have had so much about what we are hoping to achieve with these first new classes, not only is it the community, but I think it's also really where students can bring their whole selves to the classroom, right? That who you are as a person, your experiences, your identity, your history with various health topics, where you sit in your neighborhood, things like that, that students can bring their whole selves to the class and take and add to that sense of community by bringing their knowledge and experience to the classroom.
Very good. Well, one last question that I'll ask, and this one's a little bit off. This one's my own question, but it's a little bit off the submitted questions. But is there I guess the broader Emerson experience from your all's perspective, like obviously the student experience is going to be very focused on their major, but there's like so much more out there even beyond the major as well. So like from your perspective, what are some of the things that you think students would benefit the most from knowing about sort of the broader Emerson experience and community, and how that might contribute to their their experience and their education?
I love Emerson students. I love Emerson students. There is a uniqueness to the Emerson student. There's not an expectation that students come to Emerson and conform to some college norm and collegiate, sort of cookie cutter. Just the fashion in my classrooms alone is so all over the place. The interests students have, I love hearing how students are bringing in their love for different topics. I started classes today, and I had conversations about theater, and we talked about film, and it was all over the map. I would say Emerson students might be a little bit more funky than maybe at other institutions. I think because of that sort of vibe of being in art school. It feels very different than when I was taking classes in a school of medicine, with all the white coats and, and the clinicians. So the vibe is a little bit different. It is, as we mentioned before, we're in the heart of the city. I'm a Bostonian, born and bred. I love Boston. I love that we're sort of in the thick of things. We're in the middle of it all. If you like cities, like you're dropped down in the middle of the city, and everything is around us, and there's so much to do. Whether it's academically and partnering with organizations or going to the State House, but also just fun. Yeah, like we're right on Boston Common, and it's fun to bring people around, and so there's those kinds of aspects about Emerson. I love who my students are. They're we've such a weird sort of little niche, and students can really be themselves, and that I really enjoy. Jesse's going to meet her students for the first time tomorrow, so
Yeah.
I don't think you have much to add.
Yeah, I mean, I just think, it feels important, I think, for a student who's thinking about Emerson College to know, and this is like why I was drawn here to do this work, is that I think Emerson is really committed to being a mechanism of social change in this community and beyond. They're putting resources like this major, like the development of these classes, behind sort of like the words that many universities and colleges are saying with respect to thinking about anti-oppressive and anti-racist practice. Emerson, I think, is the real deal. And I think that they, the system and many of the faculty here are really committed. It's a part of the identity to think about how to make the world better here. I mean, that's why I'm here. And I think it feels important for prospective students to know that about Emerson, and that might be really different, from other educational institutions. So we're just really excited to do the work.
Yeah, our students are very passionate. And I believe, I have to double check with some folks. Last year, they were telling us that we had the second highest voter registration rate, I think, in the nation. So, which I'm not surprised by. So we've got very engaged and passionate students who care about making the world a better place.
Well, very good. Well, I think that would be a good place to end. And thank you so much, Jesse and Nancy, for your time tonight and the information you shared about the program. Like I said, very excited about the opportunities we're right at the beginning of at this point in time. It's a very exciting time in this program at Emerson. And thank you to those that joined us this evening. And a couple of quick notes just to wrap things up. There will be a recording that will be sent out to you all. And then one last note is, if you haven't already seen it on our website, we have 2 open house events this fall where you can come and see campus for yourself and engage with our community. So we strongly encourage you to do that. You can find that on our admissions web pages. The first date is September 30th coming up, and then the next event date will be in late October, and that will be posted shortly. So please join us on campus and come and ask all your questions. So thank you all, and have a good evening.